Today's question actually comes from a student of yours. He's a veteran, and he has spent some time practicing meditation and mindfulness with other veterans in a group setting. And he noticed that some people actually experienced negative outcomes from this practice without having the proper support behind it. So I wanted to talk today about this concept of using meditation and mindfulness as a form of therapy for people with PTSD or trauma, past trauma.
Mm-hmm.
Is it something that's advisable? And if so, like what are the circumstances that are needed to make sure that it's beneficial?
Good questions. Saying meditation, of course, is like saying exercise. It's so broad. And even these days, saying mindfulness is so broad that we have to kind of, everybody's going to define it a little differently. And I should probably define it the way I want to. So the problem with meditation or mindfulness is it's usually starts off with like relaxation and some light, what I would call reverie. In other words, you're present, but you're letting things flow and you're trying to relax. So you might be doing a body scan, or you might be just, telling yourself to relax, or sinking into the chair or seat or cushion, or just being outside relaxing. So that's good, right? You're relaxing and you're doing what I call reveries. You're letting internal thoughts and emotions to flow, okay? The thing with that is that can also loosen what we'd call psychological defenses against, having trauma responses or PTSD responses, right? So with some people, as they start to relax and do reverie and even do mindfulness, the trauma experiences bubble up, to use a metaphor. Sometimes they come back with, vividness, and sometimes they just, come back with a general sense of, being there, what's happening again. So that's going to go counter to what the aims of the relaxation and reverie and mindfulness is. So a criticism I have of just diving in and using apps, or just naively doing these kind of processes, is that things can happen. So if you're not in a supportive group and you're just alone, it can be hard. And you want to be with a group or be with a leader that knows what to do when obstacles come up. General obstacles are going to come up anyway, because there's generally a natural resistance to really looking within, which is what mindfulness is really about, is developing insight and stability of mind, stability of emotions. So mindfulness is more profound, or sometimes more difficult than relaxation or reverie. Mindfulness takes stability and insight and the development of it. So if people are just wading in, I'm trying to think on my feet here, then obstacles can come up, and general ones can come up, just like frustration or restlessness or boredom, which we usually just think of as our normal resistances to being present and being insightful and relaxing. But those could also be signals that there's trauma underneath, and a skilled meditation instructor or a therapist needs to explore that. Another problem is that many times people come in, saying they're anxious or depressed, and so you go, okay, relaxation and some reverie and some mindfulness, that's the cure-all. But we don't really know ahead of time if someone's had a trauma background. They don't always reveal it, right?
Mm-hmm.
Therapists, they don't always come in and say, I'm here to talk about, this thing that happened a long time ago. Usually people actually just report the surface symptoms. They're still painful, but the indicators that something's wrong, like depression or anxiety and things like that, or visions that don't make sense. So you have to explore before you immediately say, well, what you need is mindfulness or relaxation,
Mm-hmm.
or even reverie.
Well, I've often seen it, given as something that you can do if you're depressed or if you're anxious, or any of these, articles or recommendations for mental health issues. They will suggest meditation as something that you can do to help with that. Um,
It
but
usually
that's
does help. I mean, but when people say meditation, um, that's so broad that we have to be
Mhm.
specific. Um, but mostly people aren't, and then they go to get an app or something like that, and then that's usually good, right? I mean, it is usually good, but a lot of times the other problem is it's not enough. And
Okay.
people are doing relaxation, they're doing reverie, as kind of a light awareness of things coming and going, and they're doing, which is a lot of times what people think mindfulness is, but I'm defining it a little more strictly as a combination of concentration and insight. So they're doing these disciplines, but they think they're doing it wrong because the trauma isn't just resolving.
Mm. Yeah.
So, um, meditation is meant to, whether it's relaxation style or reverie style or mindfulness style, is to develop the skills to be present to our experience. But being present doesn't give you all the skills. It's just a main skill that obviously, if you're not present, you're not going to be able to do much. But
Mm-hmm.
just being present, just being mindful, or just being relaxed, or just being centered by itself is not um, the cure for trauma.
Mm.
It's creating conditions so that we can address it.
Mm-hmm.
But a lot of times people think, well, the the tools are all you need to build a house. It'd be a thing like just buy a
Oh.
toolbox and you've got your house, right? Just
Uh-huh.
buy the tools and it's all done. No, you still have to saw boards and pour concrete. Um, so learning tools and learning a technique is important, but then it has to be steered and applied in a certain way like that.
Mm.
So that's my main criticism about kind of just general meditation mindfulness is you're learning a tool, but you're not necessarily learning how to use it toward a specific goal.
Mm.
You still need training, like, okay, this screwdriver is for this, and what kind of things do you have to hammer and so forth.
And maybe some support if you make a mistake.
Well, there's always
You could put,
mistakes, that's
yeah.
it. I mean, so rarely, is there much gone into how people get sidetracked or mistakes. Um, like some apps like Headspace that have made millions, maybe billions of dollars, are very reassuring and kind. They just say, well, don't worry, mate, just return to your breath. But, that kind of quick redirection only works if a distraction or an obstacle is very light. If
Mm.
you really get hijacked by a trauma, by strong thoughts and emotions, it's not so easy to say, oh, drop it and go back to your breath. It's all right, mate.
Mm-hmm.
That's a mindfulness light.
Yeah. Yeah. So having that support when things might come up, especially if you have a past trauma, might be a good idea. Um, a confession on my side, I am a meditation practitioner now, but I never attempted meditation until I came to Lions Roar Dharma Center, because I knew that my mind was not a safe place to be because of my own, mental state and trauma and whatnot. I just didn't want to go there. But then with having guidance, I have had some anxiety and things come up in meditation, but most of it has been very positive. But there's been a lot of support. So maybe having an ongoing support, if you're going to attempt it, is a good idea.
Well, it's the best. I mean, I like using fashion and clothes metaphors, right? So having some clothes on, even if they don't fit very well, is generally better than freezing or something, right? But depending upon what people's time and commitment and resources are, you can, buy something that doesn't fit very well and meant to fit everybody, or you can buy something off the rack and have it tailored, or you could have bespoke fashion, right? You could have a dress or a suit made exclusively for you. And that's what I like to specialize in. So bespoke therapy like that.
And there are places that offer free meditation groups, right? To go to, around town.
There are, give a pitch for Lions Road Dharma Center and Sacramento Dharma Center and many other freestanding groups like that are free, that are probably going to be hybrid now, right?
Oh yeah, or even online too.
Yeah,
yes.
So a whole new world like that. And there are so many good books now and tapes. So we usually do start in private. We start reading up or listening to things, before we just show up somewhere. So it's reasonable, but at some point we, it's just faster to get some real feedback from a qualified teacher or therapist.
Is Dana still leading her meditation group as well? Putting her on the spot. She's one of the therapists at Middle Way Health.
Not right now.
Okay.
Because that group's been just on Zoom, but we'll have to talk to her, see if she's
okay. Yeah. So there are resources to connect with people.
There are resources.
Yeah, definitely. Okay, well, we're coming up on our time. Thank you so much. I really liked this question because it pulls on both areas of your expertise. So thank you for chatting with us about this.
It's fine.
Okay. All right.
See ya.
Bye.